Hi there, this is Nursing Education Videos. Today I will be going over the GCS Assessment Nursing NCLEX Questions Quiz on registerednursing.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursing.com. Again, all credit for the information that I am reading goes to Sarah at registerednursing.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Glasgow Coma Scale NCLEX Question Quiz for Nursing Students. The Glasgow Coma Scale, GCS, is used to assess a patient's level of consciousness. The nurse must be familiar with that or with what response it assesses, how to calculate a GCS score, and what that score indicates. When you're done taking the quiz, don't forget to check out other nursing neuro reviews to help you prep for exams and review the Glasgow Coma Scale notes. So first question. The Glasgow Coma Scale, GCS, assesses what areas of response to stimuli. Assess all that apply. A. Auditory response. B. Verbal response. C. Tactile response. E. Eye-opening response. D. Eye-opening response. Or E. Motor response. So Glasgow Coma Scale, there's the acronym EMV. So eye-opening response. So D. Motor response, so E, and verbal response, B. So the answers for this question will be B, verbal response, D, eye-opening response, and E, motor response. Question number 2. During the Glasgow Coma Scale assessment, the nurse applies a central painful stimuli to test the best motor response. Which of the following is not this type of stimulus? A. Trapezius squeeze, B. Fingernail bed pressure, or C. Supraorbital pressure. So this one applies a central painful stimuli to test the best motor response. So it's probably B, but we're going to look at the notes as well. We're going to review the notes and see what it is. So the fingernail bed pressure is a peripheral stimuli, and the central stimuli is the trapezius squeeze and supraorbital pressure. So the answer for this would be B, fingernail bed pressure. Question number 3. A patient has experienced a brain injury. You note that written in the progress notes, the physician says the patient has a GCS of 10, E3, V3, M4, so that's an eye opening of 3, verbal response of 3, motor response of 4. What is the level of brain injury in this patient? A. Mild brain injury, B. Moderate brain injury, or C. Severe brain injury. So on the notes here, 9 to 12 is a moderate brain injury. So this would be B, moderate brain injury. Question number 4. What Glasgow Coma Scale score usually requires intubation because the airway reflexes are affected? A, 10 or less, B, 9 or greater, C, 8 or less, or D, 10 or greater. So it says here, GCS 8 or less, the patient is in a coma and requires intubation due to the inability of airway reflexes that protect us from aspiration to work. So it would be C. Question number 5. True or false? The nurse is assessing the Glasgow Coma Scale in a patient, but is unable to assess the best verbal response due to intubation. Therefore, the nurse should assign 1 point for the best verbal response. This would be false, because we are going to assign non-testable. Because patient is intubated. That's according to notes here. Question number 6. A patient with a traumatic brain injury has sustained multiple fractures to the face and eyes. When testing the best motor response, the nurse notes the patient is unable to perform a motor command based on a verbal stimulus. The nurse attempts to use a pressure stimulus to test the motor response. What type of pressure or painful stimuli should the nurse avoid in this patient? A. Fingernail bed pressure. B. Trapezius squeeze. C. Supraorbital pressure. Or D. Toenail bed pressure. So this one says, what type of pressure or painful stimuli should the nurse avoid in this patient? It would be the supraorbital pressure, because the patient has sustained multiple fractures to the face and eyes. Question number 7. You're assessing a patient's Glasgow Coma Scale at the bedside. What is the patient's score based on these findings? When you arrive to the patient's bedside, the patient is looking around. The patient tells you they are at a concert hall and the year is 1960. It is year 2022. But they state their correct name, and they are open to successfully open their mouth and stick out their tongue. So A. GCS of 14, B. GCS of 11, C. GCS of 15, or D. GCS of 13. So E4, M5, V6 would be the total of 15. The patient is looking around, so the patient has an E4, spontaneous eye movement. If we go to 5, M5, obeys command. So they successfully open their mouth and cheek, so their M would be 5 as well. And then for verbal response, they tell you incorrect location and incorrect year. So that would be where they lose points for verbal response on the GCS. We look at here. Well, I actually got that mixed up. So it's actually E4, V5, and M6. So I opening a 4, verbal response of 5, and motor response of 6. So if the patient is not responding correctly, their verbal response would be the ones that goes down. So it would be 4 points. Confused. Answers the questions but with incorrect answers. So for this question, it would be A. GCS of 14, E4, V4, M6. Question number 8. You are assessing a patient's Glasgow Coma Scale at the bedside. What is the patient's score based on these findings? When you arrive to the patient's bedside, the patient's eyes are closed, but they open when you speak to the patient. The patient doesn't respond appropriately to the questions asked. Say words that don't make sense. In addition, the patient can't obey a motor command. Therefore, when you apply a central stimulus, the patient moves and locates and removes the stimulus. So a total score of 15 would be E4 V5 M6. So when you arrive at the patient's bedside, the eyes are closed, but they open when you speak to the patient. That would be E3. Because they respond to sound. And then not responding appropriately to questions asked and say words that doesn't make sense. That would be a V3. So it would likely be a V3. Double check the answers here. Yeah, so 3 points is inappropriate words, say random words that don't make sense to the questions. And for motor response, they can't obey a motor command. And they remove the painful stimulus. So M5 is where they localizes the pressure / pain. The brain will try to locate and remove the painful stimulus. Okay. So E3, B3, M5. That'd be a GCS of 11. So C, GCS of 11, E3, V3, M5. Question number 9. You're assessing a patient's Glasgow Coma Scale at the bedside. What is the patient's score based on these findings? When you arrive to the patient's bedside, the patient's eyes are closed, but they open when you speak to the patient. The nurse cannot assess best verbal response because the patient is intubated. In addition, the patient can't obey a motor command. Therefore, you apply central stimulus to the patient. When you apply a central stimulus, the patient flexes to withdraw the stimulus. So normal GCS is E4, V5, M6. So E of 3, the response to verbal. V is NT because they're intubated. And then M, they can't obey a motor command. Therefore, when you apply it, the patient flexes to withdraw from the stimulus. So probably M4. We'll double check. So M4 is where the patient's withdrawal, also called normal flexion. The brain will try to withdraw from the painful stimulus. So we have a total of 7 T. So the answer would be B, GCS 7T, E3, VT, M4. Question number 10. You're assessing a patient's Glasgow Coma Scale at the bedside. What is the patient's score based on these findings? When you arrive to the patient's bedside, the patient's eyes are closed and don't open when spoken to. The nurse applies a peripheral painful stimulus, and the patient's eyes open. When asked questions, the patient groans and moans noises. In addition, the patient can't obey a motor command. Therefore, when you apply a central stimulus, the patient flexes to withdraw from the stimulus. Okay, normal GCS is E4, V5, M6. The eyes are closed and don't open when spoken to. And then once a peripheral painful stimulus is applied, then the patient's eyes open. That would be E2. And then the patient groans and moans noises. That would be a V2. And in addition, the patient can't obey a motor command. Therefore, when you apply a central stimulus, the patient flexes to withdraw from the stimulus. This would be at M4. So E2, V2, M4. For a total of GCS of 8. So this would be C, GCS 8, E2, V2, M4. Alright, I'm going to input these answers and see what the results are. Alright, here are your results. Your grade is A. Percentage of what you got right, 100. So it's good that we were able to review the notes and learn from this experience to help us understand how to answer the questions and making sure we're reading the questions correctly. So I hope this was helpful. Thank you for listening, and I hope this was engaging as well. Please feel free to subscribe and click the like button and go to registerednursern.com for more information and check out their YouTube channel. And again, thank you. Hope everyone has a great day.